evening, and Don is with us here from the United States. So for him, it's rather late in the night. Welcome to this session on healthcare. My name is Chatila. Let me share my screen so that we can start immediately with the contents of the today's session. I reckon you can see my screen. So the work that we have achieved in this committee over the past few months was to reflect on how to apply a human-centered approach to assess the application, the risks of using AI systems in healthcare. And you have here the list of the committee members who have worked on discussing and drafting this report. Not all of them are with us this morning in this session. I hope they are watching. Today, this morning, we are going to have a presentation of this work that I will do. And then we will have a panel discussion. And of course, any questions you may have during the presentation and during the panel discussion, please ask in your Q&A window. So this morning with us, after my presentation, we will have points made by Eva Kaili, member of the European Parliament, Donald Combs, who is member of the committee, worked on the committee, and as I said, he's calling from East Virginia, actually. He's vice president and dean of the School of Health Professions in East Virginia Medical School. Eugenio Guglielmelli from Rome, full professor of bioengineering and pro-rector of research at University Campus Biomedico di Roma. Danny Van Rooyen, digital health director at COSIR, he's calling from Brussels. Wendy Yared, director, European Cancer League, and she's calling from London, I believe. Ben MacArthur, deputy program director for health and medical sciences, the Alan Turing Institute in the United Kingdom, from London as well. And Robert Madlen, member of the AI4People Scientific Committee and his former Director General of DG Connect. So let's examine this issue about AI in healthcare. AI is actually increasingly and successfully used in healthcare. And there are a large number of examples and applications. And as we speak, AI is used in healthcare today. One of the most known applications or domains is radiology, sonography, which actually is image processing. And it is very performant. It has high level of accuracy, which means when it provides an answer, the accuracy is really important, over 95%. And that helps to identify tumors, for example, in breast cancer and retinal disease, whatever images you are processing. And also it was really key in the diagnosis of COVID-19 pulmonary diseases during the crisis, which means we have here a technological advance that has been actually proving its efficiency and its usefulness. However, despite this very positive aspect, we shouldn't be really considering that those AI systems are fully trustworthy. They can have a high level of accuracy, At the same time, the result that they are providing can be completely wrong. And let me illustrate this, give you this example, which is from a paper published in May 2020 in the Proceedings of the National Academy of Science, and you have the references of the paper here. And actually this picture and this slide is from the paper, which I'm directly citing here, paper by Burgard, Anton, and colleagues. So here, what they want to show is that you can make small perturbation to the image that the system wouldn't differentiate from actual features. So there are some artifacts in the picture, and you can have artifacts in the images, but the system will mistake these artifacts. And this is shown here with the red arrows. You have the explanation on the right of the screen. I will not spend time on this. It's just to show you that when you introduce such artifacts, well, the system is going to, and this is a deep learning system, it's a neural net, the system is going to mistake them for actual features of the image and make very wrong interpretations. It's a very known flaw, a default of those systems, which are based on processing data with methods which are neural nets, and therefore extracting regularities from the data. The system is not actually an expert as a human being would be to understand what it is seeing. It's just comparing based on the database that it has been using, the inputs that it's processing. And there are many examples in many areas where it's well known and proven that the system can provide very wrong answers with high accuracy. So this is why we need to say that we need to work on that those systems shouldn't be already considered fully trustworthy, because such mistakes happen. And the problem is that also you don't know a priori when and in what situations they might happen. You have other examples in several applications where this happens. So I will not develop more, but this is really something which is key. Also, another point is that practitioners, medical doctors, specialists use these systems, but the interaction between them and patients isn't so transparent often, which means that there is little understanding about what is for the patient about what is happening in the use of those systems. And also, of course, this is a very strong technology, and one question is who is responsible for the diagnosis, treatment, outcomes when you use this technology, which is maturing and not fully trustworthy. Our task actually was to examine how the 7 key requirements of the high-level expert group on trustworthy AI, for trustworthy AI, how can you examine how much healthcare applications of AI could comply with these requirements. And I'm recalling these 7 requirements here so that we have them in mind. Human agency and oversight, which is a very important issue. And human agency and oversight means that you have to respect human agency and also human oversight over the machine. Technical robustness and safety. Some can consider that this is really something normal. I mean, any technological system should be technically robust and safe. Well, no, Not necessarily, not if it didn't, or how if the designers didn't actually address those issues during the design. And there are actually many computer-based systems that are used every day that didn't go through this process. So it's important to, and this is also related to ethics in terms of professional ethics. But it means also that there is a difficulty here that I'll get back to. This means that the system should be resilient to attack, security, but also safe and reliable, accurate, and reproducible. Third one is about data governance, privacy. A lot of this is actually addressed in the GDPR in Europe, but the GDPR is in Europe only. And GDPR also is not always well understood in terms of how you have to cope with health data, which is sensitive data. Transparency, and transparency means that you have means to trace the data, to trace the way the system has actually processed the data, explanation about how it worked and how it arrived to a given conclusion, and also communication about what the AI system does. And diversity is really important. This relates to fairness, non-discrimination. Again, here we have issues about how the data was collected. Does it represent the persons who are actually being the patients for the system? The social and environmental well-being might appear as not directly related to healthcare, but it is, because public health is a social well-being, of course. And public health in situation, for example, of pandemic proves how much it's important to have this in mind. This means that the system has to be sustainable, that it has to be accessible, and these are issues that can be raised also. And finally, accountability, as I said earlier, related to responsibility, and this requires audit mechanisms, the minimization of risks, reporting negative impact, and also ability of redress. These recommendations, these requirements, actually requirements is a strong term, for trustworthy AI were published in April 2019. In about a year later, in February 2020, the European Commission published the white paper on artificial intelligence, a European approach to excellence and trust. In this paper, the Commission refers to the 7 key requirements and adopts as a strategy for its future legislative instrument, which is in the making and should be announced in early the first quarter, I believe, of 2021, adopts a risk-based approach. So how is risk defined in this white paper? And I'm accepting from this paper, from this document. Well, it's a two-tier approach. First, the domain in which the AI system is being used should be recognized as a high-risk domain, which means that significant risks can be expected to occur. And of course, it's not surprising that healthcare is one of those domains, because the risk is about a human life, for example. But there are other domains as well. And the Commission expects that this list would be fully defined and updated over time. But it's not just the domain, it's also what the specific application you are looking at is doing within this domain. This is related to the fact that, for example, in some domains, you have AI applications which can be considered no risk or with non-significant risk. So it means that in this case, even if it's in a high-risk domain, it wouldn't be addressed by any legislative instrument. So in order to be actually addressed by this legislative instrument, it should be both in a high-risk domain and in a high-risk application within this domain. And this notion of risk is, of course, something really important. It's key to define this legislative instrument and to apply it. So for us in the group, it was really an important point to take into account not only the 7 key requirements, but to see how much with this approach of high risk and 2-tier risk can be, these can be applied. So risks, of course, new technologies, which means technologies that are not completely understood or not fully matured, and even those who become mature over time, they bring about benefits, but of course, also potential dangers. Those dangers are not necessarily so clear, so appearing from the onset. There might be some imaginary dangers that will never happen, and some real dangers that are not expected. Therefore, governing the introduction of these technologies is important, and it requires to elaborate a well-thought set of guidelines, policy, regulations to mitigate potential risk. But those potential risk, again, has to be correctly assessed. And what is risk? Risk is actually the probability that a danger, which is theoretical in the beginning, what is the probability of this danger to materialize? What is the probability of having the imagery system provide very wrong questions? It's not, again, about its accuracy. And this must be properly addressed. And the only way it can be properly addressed is through research, theoretical results, and also empirical data. And this is how you can actually avoid taking unnecessary measures and take correct measure. So the point is that risk assessment is not so simple, depends on the domain, and even the approach to assess the risk is not straightforward. Actually, this is mentioned also in the paper. So, for example, you could say, what is the most catastrophic consequence of system failure? For example, in an airplane, if there is a full system failure, well, the plane is going to crash. And so this is really catastrophic because there will be hundreds of lives at stake. In the medical domain, it's the life of a patient, but not only one patient, because the same AI system is being used in many places and might also repeat the same mistakes, not exactly in the same conditions because it's a complex issue, but there might be also catastrophic consequences of the same size. So this is a way to try to address risk. And the point is that we have to mitigate this risk and to evaluate its dependability, probably based on occurrence of system failure, and take appropriate measures. And for this, the 7 key requirements, which are translated into the assessment list, ALTAI, assessment list for trustworthy AI, can be of help to take these measures. So it's important to understand that risk is not just a number. It's defined in a multidimensional space. And this is an example here where you have several dimensions of risks. For example, physical integrity, physical well-being, mental well-being, privacy, if it's about data, agency, autonomy of the patient, and you have several influencing factors. Again, these are examples about the personal context, about the health history, about the patient, for example, lifetime expectancy, about the situation of the healthcare system. And of course, as you know, in the COVID crisis, the availability of the healthcare system is key. It's actually dictating the fact that we are not today together physically. And so it's not just a number. You have to assess risk in all its dimensions, and this is complex, requires really a very strong approach. But when you try to address this, you have to get back to what you can do with the system. And this is rather classical for critical systems. The notion of dependability I'm recalling here is by definition, the delivery of service, whatever the service is, the plane flies and the AI system correctly determines the diagnosis. It's the delivery of service that can justifiably be trusted. And justifiably is key because it means you have undergone several processes, you have proven, you have computed probabilities, etc., to be able to trust the system. And the resilience of the system is that it's able to persist on delivering this service despite changes, and changes can happen due to the environment. So, of course, I'm not going to give you a class about dependability, but it's important to say that the dependability of the system is threatened by faults of the system. And these threats makes the availability, reliability, safety, etc. of the system degrade. So how do you address this? Well, faults are coming from physical faults, from design faults, and from interaction faults. And in AI-based systems, design faults. It's not on purpose. A fault is not something that is on purpose. It's because by design, the system is going to make and not purposefully to make those mistakes. So how do you address this? The means to achieve dependability is to try not necessarily to prevent faults, because it's sometimes impossible, just impossible because of the complexity of the system. And we are in this case. It's more about accepting that this will happen. This is fault tolerance. So you should have the mean to make the system dependable despite the fact that faults happen, which means it's not the system on its own. The system is within, the AI system is within a wider system to limit the consequences of system failure. And this, for example, comes from having not just one AI system, but several with design diversity based on different databases, for example, or different providers that will not make the same mistakes. You have to develop means to detect that something is wrong based, for example, on this comparison, to verify the software before and to intercept the error. This is related to the design of the global system architecture and having the error-free result finally. And this is actually, again, how planes fly, because these have been applied in the aviation industry since a long time. So another point is explainability. How much do we understand about the system, what the system is doing? And as you know, AI systems are based on learning are known to be a black box, which means the millions of parameters that are within the system has no causal connection to the result. And this is important because when you have this absence of causality, you cannot say why or how exactly the system achieved a given result. So explainability is very much studied this time, and it relates to, it's a tool for understanding the system. One key point is that it depends, when you say explainability, it depends on the fact that you have to define to whom you are explaining and what you are explaining. So, for example, you are not going to explain the result of the system to this in the same way to the domain experts, the medical doctor, for example, who also looks on the image, and the system has to explain why it arrived to a given conclusion. It's not the same way as what the system would say to a, a layman, to a user, for example, which is who is affected by the decisions, but doesn't understand at all what are those data that are being processed. And it's not the same way also that you explain to regulatory entities, for example, certification authorities. So explainability is something that is actually in the making. There are hundreds of papers, research paper and application papers on this. And this is key, again, for applications. So in the group, in the committee, we have thought about concretely addressing some case studies to see how this can apply. And finally, we have focused on two cases. One is AI systems for patient triage and prioritization, and including, for example, the use of chatbots. And the other is AI systems for diagnosis. I gave examples actually from this area. And we identified risks in these domains that are common actually related to data, to discrimination, to improper interaction with the system, to overconfidence of the user or distrust of the user, to the agency or how much decisions can be made. And so in each of the two use cases, and I'm not going to spend time on this, but we have addressed actually the 7 key requirements, for example, it means to have agency. Patients have the possibility to opt out, for example, what it means about technical robustness, verification, validation, etc. And the other use case, the second use, prediction and diagnosis. Again, the 7 key requirements translate into the actual actions. For example, the use of AI systems should not override individual medical judgment. And this means that AI literacy is necessary so that and explainability is necessary. For example, the data governance, and of course, it must be compliant with the GDPR. However, maybe the GDPR is not agile enough as the technology is progressing. For example, we have here a specific thing, which is unknown future risk related to the impact on litigation with complex questions. And also this has impact on acceptability if the system makes mistakes, for example, and if litigation is not so simple. So this is related to accountability. Now, let me focus on a few conclusions, which are overarching these two use cases and representative of the healthcare application. So I have here one point first. It's that in healthcare, you have several factors which are interrelated, several agents, several actors. You have the the patient, of course. You have the medical doctor. You have the personnel in the health care system. You have the hospital. You have the management of the hospital. You have public policies about this. And it appears to us that when you speak about a specific application within the healthcare area domain, it might turn out to be difficult to assign an a priori risk level to such application. For example, if you consider the appointment system in a hospital, this might be considered as maybe a simple and not risky application. Well, it might be. It depends on the context. It depends on the pressure, the stress of the hospital, on the healthcare system. It depends on the actual situation of the patient and how much the AI system, if the AI system does do this decision about providing the date for a consultation, does some mistakes in what the person is suffering from. And this can happen, for example, if it's interacting with the chat, if the interaction is with the chatbot. One positive things about AI tools also, on the other hand, is that healthcare professionals are actually facing burnout because of the important charge, and this can be helpful for them to deploy AI systems to reduce this. And also, it can reduce also medical malpractice. So risk, I said that before, is not binary. It has several dimensions. And accountability means that we have to develop tools and also competence, human competence, for auditing. And this is also important at all levels. We found that the 7 key requirements are really applicable and important, and can provide a good tool to assess all these issues about risk. The agency aspects means that we have to better integrate also patient's view, and not just the professional medical personnel view. And for this, patients, physicians, and engineers have to find a space to interact for a better design, a better understanding of the system. Diversity of designers and developers, this is one of the actually issues in the 7 key requirements. Diversity of patients also for enabling correct AI-based simulation, and diversity of data to address diseases which are not necessarily, which are rare, for example. I mentioned also already the privacy issues about data and the GDPR flexibility. Finally, education. Education is really important everywhere, of course, and when we speak about AI, we come up often with the education aspect. In healthcare, education for health professionals, to make them aware about how the system works, about potential risks, so that they understand the tool that they are using. Because they are the operator of the system, they are the professional, they're not just users. And also, some means to increase this literacy could be, for example, a gamification model that enables a quick and hands-on training and professionalization. Also, education of the patients, so that they understand. Of course, when today in healthcare, when you are in the hospital and you are given a medication, you don't have to understand biochemistry. But when you are facing a system, when you are facing an entity which is interacting with you, it's not the same thing. The medication is given by the doctor, and if you are trusting the doctor, that changes everything about how you accept it. But when you are facing a system, that's quite different. And also, patients' empowerment should be really important to make them also part of the game. And one final point is about the impact on accessibility and affordability of healthcare. If those systems are deployed massively, this should make the healthcare system more affordable, but it might play also in the other way around. And this has to be also addressed from a global point of view, and from public policies point of view. Thank you. So in this case, Donald, could you would like to comment on
yes
the work and